First of all, I want to thank you for your persistence on this issue. I have been actually personally working on this issue related to sugar in soft drinks for years. I don't even remember how long, quite frankly. I remember we looked at the potential of a 5-cent a gallon tax or fee on the syrup years ago, and that arguably wouldn't have cost consumers a great deal, but what it would have done was given us money for dental disease prevention programs, and we couldn't even get out of the starting gate with that, quite frankly, and it's discouraging. I am prevention oriented by nature. That is my training, that is my experience, that was my career. Whether it was tobacco or sugar or just other kinds of habits, prevention is the key to long-term health, quite frankly. And so I'll ask my colleagues, and one of them's missing, but maybe he's listening somewhere, that are kind of on the fence maybe on this, to think about this a little bit. We as a state spend huge amounts of money for our Medi-Cal population on the treatment of diabetes, insulin, wound care, sometimes amputations, and sometimes prosthetics that go along with that. Huge amounts of money. We don't have the resources that we need to help with the prevention. If we could have some of that money for prevention and real programs that are ongoing programs, not a one-shot sort of program and a little education here. These have to be ongoing programs to influence people's lives. We could make a difference. And with all due respect to Mr. Rodriguez, there are skinny folks that are diabetic, okay? Oh, yeah. You don't have to be, they don't necessarily go hand in hand. And so I just, I heard somebody say thank you out there. But it's a big deal.
It's true.
In my practice, when I was practicing dentistry, I saw a couple of things. I saw the ravages of tobacco. I saw what happened to people's mouths from tobacco use. And thank goodness in 2016, we passed one of the biggest reform packages for tobacco in the last 50 years. And that will impact people's lives. That will save us money on treatment for heart disease, cancer, and it'll improve oral health. It's a huge game changer for a lot of people. I see this the same way. I see this as an opportunity because I saw in my practice young people coming into my practice with beautiful permanent teeth. These are not the 4- and 5-year-olds that were ravaged earlier. These are 11, 12, 13-year-olds drinking a half a dozen soft drinks a day. And I saw the frosted appearance of their teeth. And we'd talk about this, and then we'd see beginnings of decay. And then we'd start to see those black spots later on. And it's horrible to see. It's horrible to see. And the common denominator there was sugar-sweetened beverages. And so I believe that we need the resources. We need the prevention. I applaud your tenacity for bringing this forward. And I want to thank you for really working with colleagues. I want to thank you for working with Ms. Burke. We talked about what was of concern to her, and you met with her, and you met her on that, and I applaud you for that. So it is, I think, at a time when we are starved for resources in this huge, beautiful state, to have resources to help with this in the long run will help improve health outcomes, and maybe we'll have additional resources to cover and take care of the rest of the people in California for overall health care. Maybe it's a big dream, but maybe we can get there. We got to start somewhere.